Joining us first today is Dr. Babar Parvez. You are a clinical cardiac electrophysiologist. That is a mouthful. So what do you do, Dr. Parvez?
So a cardiac electrophysiologist is a heart rhythm specialist. We deal in helping patients with all manners of heart rhythm issues, fast heart rate, irregular heart rate, slow heart rate, and in some situations, almost no heart rate.
Okay, so you see a wide spectrum of patients coming in.
That's correct.
Okay, so today, to learn more about AFib, we've constructed a quiz-style game show, if you will say, and we're going to go through some questions, and we're going to talk about AFib. And how we've structured this is we're going to answer the who, what, when, where, why, and how when it comes to AFib. Does that sound like a good plan?
Sounds like fun.
Okay, let's go ahead and take a look at the first question. What is atrial fibrillation, or AFib?
Yes.
So irregular heart rhythm, rapid heart rhythm, poor blood flow within the heart, or all of the above?
It's all of the above. Irregular heart rhythm is exactly what AFib is. A normal heart beats 1-to-1. The top beat, squeeze the blood down to the bottom chambers, and then the bottom beat, and then squeeze the blood to the rest of the body. So it's like walking one step after another. Atrial fibrillation is quivering of the top chambers, irregular beating, where the top chambers don't necessarily completely squeeze or effectively squeeze. So that causes irregular heart beating. It's not 100% always fast heart beating. Irregular atrial fibrillation can be normal heart rate, where the person checks the pulse and it is normal. Mm-hmm. It is still AFib, still concerning, and it is normal. And then there are some patients that actually present with a slow heart rate. But predominantly, vast majority, I would say over 70%, come with a fast heart rate.
Is it possible for somebody to have no symptoms at all?
It is possible, and we do see that. And those are the ones, unfortunately, we worry about the most because they are the most at risk for stroke. So even in those patients where they don't have the conventional symptoms, weakness and exhaustion is one thing that I tell everybody to look out for. Mm-hmm. If you are overtly feeling exhausted consistently, mm-hmm. when you were not before, get yourself checked out.
That's good advice. All right, let's take a look. Our next question is, who is at risk for developing AFib? A, people 65 years and older. B, people with a family history of AFib. C, people with underlying heart disease or other medical conditions, or all of the above?
All of the above. It's everybody. We have patients in their early 20s with atrial fibrillation. In this part of the world, 65 and above is common because that's where people have already accumulated a number of other health issues, diabetes, hypertension. Obesity is very prevalent, and with obesity comes a lot of health issues, including sleep apnea.
What are the risks of leaving this untreated?
When you have atrial fibrillation untreated, going on and on, strokes start happening, the heart muscle starts becoming weak, neurologic strokes start happening, blood pressure goes down, and ultimately people can expire.
Okay. When should someone seek care? A, at the start of symptoms. B, when someone in your family is diagnosed. C, if changes in your health are causing concern. Or D, all of the above?
All of the above. So if you are unsure, if you feel unwell for any reason, if you have a family member diagnosed, if you have any health ailment which puts you at risk for AFib, you can have yourself checked out. If you have a robust community healthcare system like ThedaCare is, which has been embedded in the community for 100 years, you don't have to go far. Mm-hmm. ThedaCare has many places you can go to, primary care, urgent care, hospitals. So all you have to do is go and ask for help. And for AFib, it doesn't require a very fancy test. A simple EKG can, at least in the moment, tell you whether you are in AFib or not. And then with your physician and through us, we can make a plan, an individual plan.
Okay. Next one up here, this is so interesting. It's where. Which wearable devices can detect AFib? So smartwatches, smart rings, fitness trackers, or D, depends on the technology?
All of the above and depends on the technology. Mobile cardia is a device which is not a wearable device. You don't wear it. You touch it, and it gives you a EKG, and you see it on your phone, and your healthcare provider can see it on your phone. Apple Watch does the exact same thing. And then we can use it to tell you whether or not, while you were having your symptoms, was there anything going on with your heart.
It's incredible. Our next one up there, why are cases of AFib projected to increase? A, social determinants, B, physical and nutritional lifestyles, C, stress management, or D, all of the above?
All of the above. On top of the A, I would even put which is the main risk factor, is age. Cancer doctors say live long enough, everybody will get cancer. Electrophysiologists like myself say live long enough, everybody will get AFib. Age is the biggest risk factor for atrial fibrillation.
Okay. All right. How can people treat AFib? A, medications and device monitoring, B, minimally invasive surgery, C, lifestyle changes, or D, all of the above?
All of the above. The first two are things which others do to you,
Sure.
like your doctor. Your doctor will prescribe you a drug. Your doctor will recommend an invasive procedure. But lifestyle is something which is in your control. Be more physically active. We don't want everybody to turn into an Olympian. But we want you to be active. We want you to move around. Secondly is diet. Diet is good is because it's a long-term effect on the body. And unfortunately, that effect cannot be reversed overnight. So if you've been eating something on a particular way for 40, 50 years, like many people smoke, and all of a sudden they quit, the expectation that all those years of smoking and eating bad will reverse overnight, no. A moving train takes time to stop, and then to reverse takes almost the equal amount of time.
All right, Dr. Parvez, this has been really great information. We appreciate you explaining all of this to us so we can better understand what AFib really is.
Thank you.